Welcome to Climate Change and Health in Small Island Developing States focused on the Caribbean. If you require translation into Spanish or French, please use the link posted in the chat and choose your desired language at the bottom of the Zoom screen. You should continue to keep this current browser open as well to utilize the chat and Q&A features. Please be sure to scroll down and mute the video. Please use the Q&A feature to submit any questions for the panelists. This session is being recorded. Thank you.
Good morning, good afternoon, good evening to you all, and thank you so much for joining us. I am Georgiana Gordon-Strachan, and I am honored, excited, and delighted to be the moderator of the opening ceremony of this very important conference on climate change and health in small island developing states. This conference has a special focus on the Caribbean, and one of our primary goals is to contribute toward the development of a research and implementation agenda for climate change and health in the Caribbean. Climate change is having multiple adverse health effects on our region. We have been having more intense hurricanes, accelerating sea level rise, extreme heat, warming of our oceans, drought, and other climate changes that have impacted our food and water security. There is also hurricane-induced disruption of medical care for persons living with chronic diseases. We've been experiencing health-related illnesses, the spread of vector-borne and waterborne infections, diminished air quality, and mental health disorders. But we know as Caribbean people firsthand the impact of climate change on our health. As a group, our stress levels between June and November of each year is raised as we brace ourselves for the impending hurricane season. Last year, for example, we had the most hurricanes on record. We literally went through hurricane names from A to Z and then started on the Greek alphabet. I can accurately say that we have the lived experience of climate change. From our health side, our leading cause of death is chronic non-communicable diseases, and this is in part driven by climate change. But how do these climate activities interface directly with our health? For this, I will tell you two short stories. The first is about little Amy, who was 2 years old when Hurricane Irma destroyed her home. Now at age 6, Amy still cries whenever she hears that a hurricane may be coming, and she displays visible signs of anxiety. The second I'd like to tell you about is about a little lady who's called Miss Mama. Miss Mama says, "Every time the rain falls, my blood pressure rises, and I have to take my medication." As it brings me back to the time when we were forced to leave our homes because the sea came in and never went back. While these are isolated events, I think they help to bring home the story of the impact of climate change on our health at the individual level. For these reasons, more than 25 partners have joined forces to tackle this crisis of climate change and health in the Caribbean. Over the next 4 days, we will gather to deliberate on these issues, and I can assure you that this is not going to be just another conversation. As I can assure you also that all of our partners are passionate about this issue, and the one goal of this conference is to identify the gaps in our knowledge and in our implementation of climate adaptation and mitigation strategies, and to develop climate action-oriented research and implementation agenda to address them. We kick off today, or if you will allow me to use Caribbean cricket parlance, we start over with the opening ceremony, which has a stellar lineup of presenters, each well accomplished and globally recognized as thought leaders in climate change and health. We will then go to our keynote address, which will be delivered by Professor Michael Taylor. Each day of the conference has a different theme, and that adds to its interest and its. On day one, we will discuss the varied effects of climate change on health. On day two, we look at the immediate health benefits of climate mitigation and adaptation. On day three, we examine the role of the health sector in addressing climate change and health. We close on day four by looking at how we work together to implement the research agenda through participation, representation, and collaboration to implement the research agenda. But ladies and gentlemen, I hasten to say to you that that's not all. We also have young researchers who will be displaying their research in 5-minute lightning talks. Each day has a special signature event which will pull together different stakeholders as we ask hard questions about climate change and health, questions relating to funding and the role of the youth, and many other controversial and interesting issues. I hope you will join us for the next 4 days for what is definitely going to be an enlightening, thought-provoking conference, which will end with an agenda for action-oriented climate action in research and implementation. You will note that I said action twice, and that is for emphasis. Let's now focus our attention on the opening sermon. As I said before, we have a stellar lineup of speakers. We start today with Professor Maureen Lichtveld. Professor Lichtveld is the Dean of the School of Public Health at the University of Pittsburgh. Dean Lichtveld studied medicine in Suriname, and she is a professor of environmental health. She has over 30 years experience in this field, and we are pleased to invite Dean Lichtveld to deliver her presentation. Dean Lichtveld.
Thank you very much for, I'm already excited and we just got started. On behalf of, I welcome you to our very special conference where over 1,058 of us are joining to learn, are joining to work together, are joining to identify what the science is that will help us address this climate crisis in the Caribbean, are joining to learn what the knowledge gaps are, but above all, are joining to develop solutions that will assure a healthier life for all of us in the Caribbean, and in fact, all of us in the world. It is on behalf of that world and on behalf of Earth Medic and Earth Nurse that I bring you welcoming remarks. Earth Medic and Earth Nurse stand on the shoulders of a giant man. Now, he's not giant in size, he's giant in mind and giant in commitment. And so we couldn't have done this without Dr. James Hospitalis, who really is the founding member of our organization. Earth Medic and Earth Nurse mission is to build capacity and empower the health and environmental professional workforce to take action. Again, not the third time you're hearing action today, and we're only 6 minutes into the conference, to take action to counter the climate and health consequences in the Caribbean. Now, we don't do it by ourselves. And so the next big shoulders are Dr. Robert Dubrow, who is at Yale, and his entire Yale team, who made it possible that we're seamlessly being able to provide you translation in English, Spanish, and French as you're joining us for this conference. In addition to what you've heard, the 4 days are packed of action that will include, there is also a conference group that has been coordinating this for many, many months. And so we'd like to thank the Edward and Dorothy Clark Kempf Memorial Fund, the Council on Latin American and Iberian Studies at the Whitney and Betty Macmillan Center for International and Area Studies at Yale. We'd like to thank the Burroughs Wellcome Fund, the European Union, the University of Pittsburgh, or my own School of Public Health, Emory University Rollins School of Public Health, the Yale Institute for Global Health, the Inter-American Development Bank, the Guardian Group Charitable Foundation, for all of these, the generous foundations, so the donations. So what is this conference all about, and what are these 4 days? We're beginning in the Caribbean, but that's not where we're stopping. We'll focus globally of how we can have an impact. But in the Caribbean, where our communities, and yes, I'm very much a member of the Caribbean, where all our communities are disproportionately impacted by climate and health, and yet we're not the culprit of that pollution. We come together as an example for the world to show how we can take action and come up with solutions that are beneficial to all of us. And so whether we look at the effects of climate and health on day 1 and the immediate health benefits on day 2 and the health sector and its role on day 3, but above all, on the networking and participation on day 4, we can't wait to get started. So on behalf of UDMEDIC and UDNURS, welcome. Thank you.
Thank you, Dean. Thank you, Dean Lichtveld. Thank you so very much. And I join you in recognizing our partners and our steering committee, ably led by Dr. Hospedales and Professor Robert Dubrow. Our next speaker is someone who I'm pleased to introduce. This is an amazing young lady and a youth leader. Ladies and gentlemen, please join me in welcoming Priyanka Lalla. Priyanka is only 14 years old, and she is the UNICEF Youth Advocate for the Eastern Caribbean. She represents the youth at this forum. She's passionate about advocating for climate action, and she is one of the voices of her generation who has been tackling the challenges of climate change. Priyanka, please go ahead and deliver your address. Thank you.
Thank you, Madam Chair, and good afternoon, ladies and gentlemen, all protocols observed. I wish to express my sincere appreciation to the conference organizers for the invitation to address this gathering of World Health experts, researchers, and policymakers. I wish to also commend you for including the youth voice and for creating an opportunity for intergenerational dialogue. Including us at the table makes me feel hopeful. I'm sure we all agree with the UN General Secretary Antonio Guterres that the recent IPCC report is a code red for humanity, and we must act decisively to keep 1.5 alive. As grim as our situation may seem, we cannot look the future in despair. Small island developing states such as Trinidad and Tobago and our Caribbean partners are even more vulnerable due to our size, low-lying coastal communities, and our limited resources to combat climate change. I have hope that my generation can protect and preserve our Earth. We have the energy and the enthusiasm to take on this challenge, but we need your help. We need you to work with us. Your years of research, your expertise, and your wisdom can help us put our ideas into practice and to ensure that the future we are fighting for will one day be our reality. We want the opportunity to fulfill our dreams and ambitions and to make a meaningful contribution to our planet so that we can leave it more beautiful than we found it for future generations. When Hurricanes Irma and Maria struck, I was devastated. I decided that I was going to take personal responsibility to protect and preserve our region from the devastating impact of climate change. We do not have time for a blame game. We can only take the time to act in solidarity and to build a more sustainable and resilient planet for all. Interestingly, children and young people contribute least to our carbon emissions, but many suffer tremendously, and they often suffer in silence. And this is why I advocate for child rights, including children with disabilities. I think once children are safe, healthy, and equipped to face the world, they can achieve their full potential. We are seeing and feeling the impact of climate change more than ever, and we are experiencing temperature increases and changing precipitation patterns. With increased rainfall, often off-season, flash flooding is extreme, along with landslides, sea level rise, and coastal erosion. I was 6 years old when I experienced the impact of flash floods in my primary school in Marival. While there was no physical harm to students, many experienced anxiety and trauma every time it rained. Children across all levels of society are affected by heat waves and dust. Asthma and allergies to dust is common in Trinidad and Tobago. Those in lower socioeconomic levels are severely impacted when there are flash floods. The damage and loss to property, livestock, farm, crops, water supplies, and even personal items of children, such as school books and uniforms, set these families back year after year. The threat to health is a tragedy for children and young people who are adversely affected by climate change. Floodwaters contaminate water supplies and damage crops that they rely on for their meals. The floods put them at risk for both vector and insect-borne diseases. These precarious positions leave their parents cash-strapped and unable to provide nutritious and well-balanced meals. The triple burden of malnutrition is glaring amongst this group. They suffer from undernutrition, micronutrient deficiencies, and non-communicable diseases. Child obesity, diabetes, hypertension, fatigue, and even depression are directly related to poor diets and living conditions. And the COVID-19 pandemic has worsened this position. So where do we go from here? The Caribbean has had a history of commitments to tackling the unique challenges of small island developing states, but we are far from fulfilling the goals of the Samoa Pathway and the Millennium Development Goals, and we need to realistically ask ourselves if we are ready to attain sustainable development goals by 2030. I believe that we still have time to act in solidarity and if we act urgently. The small steps that I take to mitigate climate change come from my own research. Therefore, education is key. The knowledge gap between experts and policymakers and those affected is huge. While your empirical data and your research papers have all the findings and solutions, they are meaningless unless that knowledge is in the hands of the people who are directly affected. This information can reach people in lower socioeconomic levels through community outreach programs and education. Special attention must be paid to educating girls who are home workers and who are often solely responsible for raising children. Families need to teach green skills, and how to collect and store water is critical to mitigating against vector and insect-borne diseases and ensuring sanitation. They also need to know how to provide cost-effective and healthy meals, and how to reduce their carbon footprint, and how to adapt to climate change by knowing where to build their houses and where to plant their crops. Youth activists, community service organizations, NGOs play a pivotal role in this process. Governments must ensure that school curriculum must also include this information for children and young people. After all, we are the agents for change. Schools and other facilities must be designed to address increased temperatures. Health and climate change policies must be child sensitive. Yesterday, I started in-person school for the first time since March 2020. I launched a zero waste lunch kit challenge to my friends and schoolmates, where I'm encouraged them to reduce their carbon footprint at school in our lunch kits, in our pencil cases, and across as many areas as we can. I also challenged them to grow one item that they will snack on. This is called Eat Green, Live Blue. And this is my simple contribution to mitigating and adapting to climate change. I look forward to sharing more with you on another occasion. Executive Director of UNICEF, Henrietta Fore, says that every child deserves a livable planet. I hope that the outcome of this conference will be innovative solutions to help us survive, grow, and thrive. Thank you very much for this opportunity to address you today.
Thank you so much, Priyanka. And I think you will all agree with me that she represented the youth very well. And we assure you that we take seriously the issues that will affect your generation. This also brings to light issues of social justice, as your generation did not create this problem, but you will suffer the brunt of it. I especially liked that you said, there's no time for blaming, let's move on. I encourage you to continue with your work in this regard, and I also assure you that we have thought through a very important conference with many speakers who are designed to address some of these issues. I hope you will be able to join us for some of those sessions. Thank you again, Priyanka. And I have to say, listening to you reassures us and gives us all hope for the future of our region. Thank you. Our next speaker is Professor Marcella Nuñez-Smith. Professor Nuñez-Smith is no stranger to the Caribbean, as she was born right here at the US Virgin Islands. She leads one of the most important research projects on chronic non-communicable diseases in the Eastern Caribbean. She is the Associate Dean for Health Equity Research and the C.N.H. Long Professor of Medicine, Public Health, and Management at Yale University. Dr. Nuñez currently serves as Senior Advisor to the White House COVID-19 response team, and she chairs the Presidential COVID-19 Health Equity Task Force. Professor Nuñez-Smith, we are pleased to invite you to deliver your remarks. Professor Smith is unable to join us directly, so her presentation was pre-recorded. Please go ahead. Thank you.
Hello, and thank you so much for the invitation to join today. I'm Dr. Marcella Nuñez-Smith, currently serving as Senior Advisor to the White House COVID-19 response team and as Chair of the Presidential COVID-19 Health Equity Task Force. But I'm especially pleased to be joining you today as Lead Principal Investigator of the Eastern Caribbean Health Outcomes Research Network, or ECORN, one of the Planning Committee partner organizations for this exciting and timely event. With partners from the US Virgin Islands, Puerto Rico, Barbados, and Trinidad, ECORN is a first of its kind research network, enabling that kind of deep networking and partnership, knowledge sharing, and professional development across the region and across historical boundaries. Our consortium of stakeholders includes more than 30 health, policy, and community organizations that work together, addressing the increasing burden of non-communicable disease in the Caribbean. In our research portfolio, which includes the flagship intergenerational ECORN Core study and its many ancillary studies, examines the individual, familial, and environmental factors associated with chronic disease in the Caribbean, presenting a unique opportunity to identify risk and, yes, protective factors for chronic disease. We have the benefit of working with a really diverse population and following them over time. Particularly relevant for today's conversation, our research on climate change and health, which is led by Dr. Sadia Hassan, presents an important opportunity to further emphasize the role of climate in our work to reduce the burden of NCDs in the region. Particularly for small island states, small islands generally, climate change and NCDs are a double burden. It only reifies existing health inequities, both within and between countries and islands. You already know this. As severe adverse weather events become more common, they will continue to disproportionately affect those who are least responsible for global greenhouse gas emissions. The Caribbean is among these regions with high climate vulnerability and low emission. Globally, the Caribbean has the highest numbers of storms per year, disasters that disrupt healthcare systems, limit access to medication and medical advice, cause a new mental health challenge, cut off access to clean water and healthy food, and increasingly establishes reliance on a network of ad hoc volunteers. We have to consider as well the economy and economic effects, which we know are inextricably linked with health outcomes. That includes decreased job productivity, migration and displacement, and decreased tourism. The evidence is there and it's abundant. Climate change impacts health in myriad ways. For us in our work in ECORN, we focus on NCDs because they present an increasingly urgent point of concern in global health, accounting for nearly 50% of mortality around the world. And 75% of mortality due to chronic disease occurs in low to middle income countries. In the Caribbean, the region experiences a high prevalence of NCDs and the highest premature mortality due to NCDs in all the Americas. The Caribbean's high burden of NCDs combined with the inequitable burden that the region bears due to climate change, now that's a recipe for disaster for Caribbean peoples. The disruption that climate causes, affecting the most common NCDs, such as asthma, COPD, diabetes, hypertension, heart disease, mental health, cancer, more, a multitude of ways. You all will be presenting on this most certainly in this meeting. One space we at ECORN have explored is the effect of natural disasters on the lives of people living with NCDs. An estimated 1/3 of the deaths after the devastating 2017 hurricanes Irma and Maria, those were found to be due to poorly managed NCDs. These storms brought devastating effects to the insulin supply on islands, where 1 in 6 people have diabetes. One of the reasons why this convening is so important is because all too often conversations about health and climate change happen in silos. And this segmentation, it's not responsive to the deeply interconnected reality of our lives, that interconnection of planetary and personal health, of ecological and human well-being, especially as it pertains to climate and NCDs. So we are highlighting the need to strengthen research capacity to generate the necessary evidence that will inform policy and practice, that will mitigate against, adapt to those deleterious effects of climate change on the lives of people in the Caribbean. We need all sorts of research, but especially implementation research that will inform effective mitigation and adaptation strategies that reduce the burden of NCDs and improve those lives of those in the Caribbean living with NCDs. So I'm incredibly grateful to Earthmedic, to the Yale Center for Climate Change and Health, and all of the other partners here today, bringing much needed attention to these issues. And certainly to all the researchers, the students and learners, the health professionals, the policymakers, the advocates, and the community members who are here to participate and drive this conversation and change. I am personally encouraged by the work being done by each of you to bridge this gap. As we expand our capacity to see these crises as interconnected, we generate the imagination, the creativity, and yes, the partnership needed to meaningfully address them. So thank you so much for all of your hard work, and please be well.
Thank you so much, Professor Nuñez, for your presentation. You certainly reminded us about the role of chronic non-communicable diseases in our countries and the importance and the interlinkages between that and climate change. Our next speaker is Professor Sir Hilary Beckles. And ladies and gentlemen, I think you will agree with me that he needs no introduction. I will go on to say that any introduction by me would inadequately represent the measure of the man. Sir Hilary Beckles is a professor of economic history. He is, among many other things, the president of the Universities of the Caribbean and chairman of the CARICOM's Reparations Commission. He is a thought leader, an advocate for global social justice, and a visionary. He has had widespread global recognition for his academic and leadership achievements and was knighted by the government of Barbados. He is a recipient of many awards, and most recently, he received the Martin Luther King Jr. Peace and Freedom Award. I'm very pleased to present to you the Vice Chancellor of the University of the West Indies, a key partner in this conference, Professor Sir Hilary Beckles.
It is my honor and pleasure as Vice Chancellor of the University of the West Indies to welcome each and every one of you to this virtual conference on climate change and health within the context of the small island developing states. I take this opportunity also to welcome our development partners, our university leaders and administrators, and our sponsors who have made this event possible. This conference will focus on the critical convergence which is before us at this time. And I have described this convergence as the interlocking nature of the triple C paradigm: chronic diseases, climate change, and COVID-19, that have brought together a cocktail of devastation upon not only Caribbean societies and economies, but especially upon those post-colonial nations within the context of their small island developing paradigms. We are faced with a significant social crisis, economic subversion, and indeed an existential threat, all combined to create within the realities of small island developing nations a public health disaster. In the Caribbean context, we have seen also the convergence of history, of health, and persistent hurricanes. We know this history very well, this history of increasingly violent hurricanes devastating the poor, who for no reason other than poverty and extraction and exploitation do find themselves most vulnerable to the ravages of these hurricanes, oftentimes creating public health disasters. There is the history and the legacy of poverty and social chaos that have resulted from this galloping force of chronic diseases and climate change. And now the pandemic of COVID-19 that has opened the wound created by history now to be exposed for all to see. We have seen our university, along with many other fine universities, participating in finding solutions to the public health crisis associated with chronic diseases, climate change, and now COVID-19. Some of these finest universities have defined themselves as activists. Activists in the sense that they are daily looking for solutions through applied research and innovative policies to create answers at the community level for the public health consequences of these disasters. Many universities have joined in the pursuit of ensuring that their societies do participate in finding solutions within the context of the Sustainable Development Goals. The role of this conference, therefore, is to bring together academics and professionals and development partners who are committed to sharing and caring, who are committed to partnering and participating in the solutions for survival. This is an age in which the excellent and ethical university has a critical role to play. This is a moment in time in which they are forced to show their commitment, their courage, and critically, their responsibility as the custodians of research, how best to apply that organized knowledge to enhance a better lifestyle for everyone. This is a conference then that is located within this context. So let us organize. Let us rise up together. Let us demonstrate that we do this. This is our mission, that we do this work, not only for our communities, but for humanity as a whole. I wish for everyone an excellent and engaged and stimulated and rewarding conference. Blessings for everyone.
Thank you, Professor Beckles. Professor Beckles left us with a charge, a call to rise up together, because we do this not for our own selves, but for humanity as a whole. I really like that quote. It's a tweetable quote, I think. Thank you, Professor Beckles, for your presentation. We know that you were not able to be with us, and we're grateful to you for showing your commitment to this climate change and health crisis by sending your pre-recorded video. Our next presenter, ladies and gentlemen, is someone from our own shores. She is Dr. Carissa Etienne, the director of the Pan American Health Organization and regional director of the Americas of the World Health Organization. Dr. Etienne is a native of Dominica and received her medical training at the University of the West Indies and her postgraduate training at the London School of Hygiene and Tropical Medicine. She's currently serving her second term as director of PAHO. Her portfolio includes all countries in Latin America and the Caribbean. And I think you will agree with me that climate change in this region and climate change action for this region of Latin America and the Caribbean is an imperative for Dr. Etienne. Dr. Etienne was not able to join us in person, but she has sent a pre-recorded video. Welcome, Dr. Etienne. We look forward to your comments.
It gives me great pleasure to participate in the opening ceremony of the Conference on Climate Change and Health in Small Island States and the focus on the Caribbean. I would like to thank Dr. James Hospitales and Dr. Robert Dubrow for the kind invitation. I can see from the agenda that several stakeholders and partners have been involved in the planning of the conference, bringing a remarkable lineup of speakers. This event reflects a strong multi-sectoral approach to climate and health, integrating a broad spectrum of climate and health issues. My sincere congratulations to the organizers. The first ever conference on climate change and health in small island developing states was held in Barbados in 2002. Much has happened between then and now as a result of the adoption of the 2030 Agenda for Sustainable Development, the Paris Agreement on Climate Change, and the Sendai Framework for Disaster Risk Reduction. In that regard, please allow me to recognize three major developments that have contributed to shaping our collaboration and the way forward. In 2017, WHO launched the SIDS initiative on climate change and health at the COP23 with a vision that all health systems in small island development states would be resilient to climate variability and change by 2030. In response to this call, regional action plans have been prepared, including the Caribbean Action Plan on Climate Change and Health, which I launched with several ministers of health at the third Global Conference on Health and Climate Change that was held in Grenada. In 2020, WHO was approved as a Green Climate Fund Readiness Delivery Partner, enabling the organization to support countries in accessing readiness funds, undertaking adaptation planning, and developing strategic frameworks to build their programming with the Green Climate Fund. I am pleased today to inform you that one of the first readiness project proposals that have been accepted for funding will be in the Caribbean. Last week, the PAHO 59th Directing Council adopted a One Health policy aimed at fostering coordination and collaboration among the different governance frameworks of human, animal, and environmental health programs, and at guiding the actions of national health authorities and also PAHO's technical cooperation. This has the potential to contribute to better prevent and prepare for current and future health threats at the human-animal environment interface, including the negative impacts of climate change. These initiatives suggest that we are heading in the right direction to place our health response to climate change on political and development agendas of the Caribbean and indeed the entire region of the Americas. Despite this progress, however, there are still major challenges to confront. Health-related climate activities are dangerously underfunded. Less than 2% of total climate change funding has gone to health projects. Furthermore, SIDS have received only 2% of the total funding for climate change adaptation efforts. This represents a significant financing gap that must be filled. We also need financing to take the action that is required to protect our people from risks that are not of their making. This is not only about more money, it is about smarter, more sustainable investment. For example, there is an urgent need to consider how investments to support and revive the economy of the Caribbean following the COVID pandemic can reinforce the transition to a greener, more resilient, and healthier future. We need continued strengthening of the technical, human resource, and financial capacity of our national and regional institutions. We need health systems that are resilient, that are built on primary health care, that are well-financed, well-governed, adaptable, and with smart facilities. In the Caribbean, CAIHR, with the financial support of the United Kingdom and the European Union, has developed what is the gold standard for resilient health facilities, as it combines the capacity for enhanced healthcare delivery before, during, and after disasters and epidemics, as well as climate change mitigation and adaptation. By the end of 2021, 49 safe and green, or what we call smart hospitals and facilities, will be developed, and 12 are already in line for 2022. Ensuring that the health sector is part of climate change, multi-sectoral dialogue, and decision-making is essential and requires our best advocacy and a unified front. If we want to ensure long-term sustainability and success, we need to have a seat at the table with the most important actors. This pandemic has demonstrated that health and the economy are intrinsically linked and mutually beneficial. Health must be an integral part of the climate debate and of any action to mitigate, adapt, or respond to climate change. And we wish to draw the attention of the national authorities to this. CAIHR is committed to continue working with governments as well as public and private partners in fostering climate resilient and environmentally sustainable health systems. We are advocating for the commitment of governments to develop or to continue developing health systems that are resilient to the impacts of climate change, sustainable, and low carbon. You know, we are in this together, and together we must work to ensure that our islands and our people will have a healthy future. Thank you, and I wish you well for the rest of the meeting.
Thank you, Dr. Etienne. Thank you, Dr. Etienne, for your insightful presentation and for reminding us that the first conference on climate change and health was actually held here in Barbados. for also pointing out to us that all our health systems are that we need to develop and that we have developed Caribbean action plans for climate change and health. And we thank you for your role in that. Our next speaker is Dr. the Honorable Timothy Harris. He's the third Prime Minister of St. Kitts and Nevis, and he has won every seat in every general election that he has participated in. He has responsibility for health in the quasi-CARICOM cabinet, and we invite him to deliver his presentation. Thank you.
Distinguished colleagues and partners, the 21st session of the Conference of the Parties of the United Nations Climate Conference in December 2015 was a watershed moment in the history of the world, with the adoption of a universal climate agreement, the Paris Accord. This agreement signaled our global commitment to save humanity, to secure a more sustainable planet for future generations. Caribbean countries and other small island developing states, which have long been on the front line of severe impacts due to climate change, joined the campaign for immediate global action to change course. 1.5 to stay alive. 5 years later, the sixth assessment report of the Intergovernmental Panel on Climate Change spells out the accelerating global climate crisis in ominous detail. Aptly described by UN Secretary General Antonio Guterres as a code red for humanity. This revelation is particularly disheartening for already vulnerable small island developing states, which over the last decade have been grappling with unprecedented challenges across every sector due to climate change. The Caribbean Community Climate Change Center recently noted that, quote, between 2010 and 2020, the region has been impacted by over 150 disasters that directly impacted over 22 million people, end of quote. Hurricanes Irma and Maria in 2017 and Dorian in 2019 were major storms that wreaked havoc on our brothers and sisters across the region. The International Monetary Fund determined that Hurricane Maria was estimated to have cost Dominica some 225% of its GDP. The human, social, and economic costs of these disasters continue to thwart the growth and prosperity of our countries, as well as our gains in attaining the Sustainable Development Goals. While the climate emergency demands our immediate and collective attention, over the past year, the world has been witnessing a convergence of crises as the COVID-19 pandemic has generated unprecedented shocks on our lives and livelihoods. The recent surge in infections, hospitalizations, deaths, and the prevailing vaccine hesitancy across the Caribbean region is of great concern. Additionally, the high prevalence of non-communicable diseases renders these vulnerable groups susceptible to contracting severe symptoms of the virus. These challenges further impair our battle against COVID-19 and delay our recovery efforts. For this reason, we continue to insist on access to financing that accounts for our vulnerabilities and not just our perceived wealth. This conference undoubtedly is timely. When we sheltered in place and had to make difficult decisions between the health of our people and the sustainability of our economies, we were acutely aware that we were experiencing a precursor to the adaptation actions our countries need to take. We stand now with two diverging roads before us. Do we take comprehensive, concerted action, or do we revert to the unjust and unequal world where the most vulnerable will suffer the greatest consequences? The number and diversity of partners and participants that have assembled for this conference leads me to believe that we understand the momentous challenge before us, and we are willing to take the action needed to safeguard our region. We look forward to this climate and health movement growing from strength to strength. This conference occurs in the middle of two very important milestone events, the Food Systems Summit and COP26. Both emphasize the necessity of healthy people for a healthy planet. International cooperation and multilateral systems have an increasing role to play in coordinating our collective action to reduce carbon emissions, to slow global warming, and to mobilize access to resources to implement mitigation and adaptation measures in order to build resilience and avoid even more catastrophic outcomes. My expectations for this conference are, therefore, not unlike the objectives of the conference planners. Their importance demands their re-emphasis. A well-thought-out research agenda, focus on implementation gaps, and actionable areas across timescales. An emphasis on synergistic approaches and working better together, reducing methods of actions in silos, empowering our people through understanding and a shared vision for the region's sustainable and resilient development. Human civilization, economic systems, our health, and more are at risk. We must therefore redouble our efforts to safeguard our world for future generations. In closing, I pray that God gives us the grace to come together in one accord to care for all that He has created. I thank you and wish this conference all the very best.
Thank you, Prime Minister, and thank you for representing the highest level of office in our region. Ladies and gentlemen, please join me in thanking our presenters. I'm sure you will agree with me that this opening ceremony did not disappoint and that it certainly set the stage for what is to come. The presentations were insightful and interesting, and they challenged us, but they also gave us hope. Thank you for joining, and please join the keynote address, which starts on the hour. The title of that address is Downsizing Climate Science to the Caribbean SIDS, Implications for Action, and it will be delivered by Professor Michael Taylor. I look forward to seeing you at the other sessions in the conference. Thank you.